Hey guys, today I'm going to be offering an analysis on a series of studies done by Katharina Dalton, looking at the connection between intelligence and prenatal progesterone administration. The reason we'll be doing this is because the results of these studies are just simply amazing. So long story short, basically what she found was that you could make child geniuses on basically at will by administering progesterone to pregnant women during the gestation. I really have no clue why haven't these results been gone viral, or why isn't everybody talking about this, and that's why I want to talk about it. I'll first give you a brief summary of the studies, and then we'll get into the specific results of each study and specifically what they found. So why were these studies performed in the first place? The history behind this is that Katharina Dalton was a doctor who had a medical practice, and she was treating pregnant women with progesterone for toxemia of pregnancy, also known as preeclampsia, which is a pretty common disorder in pregnancy with a lot of nasty effects, which is associated with a lot of poor outcomes for both the mother and baby during the pregnancy, and basically associated with lower IQs in the baby is one of the results of this disease. Even at the time, progesterone was well known to protect against this, and that's what it was used for. It wasn't a revolutionary approach as far as I know at the time, and still isn't. But what is revolutionary is what she found out later, is that the children of these mothers were extremely bright in some ways, including what is known as IQ. One of her patients noticed this, or she noticed it when a lot of her patients went back to her and were basically bragging about how smart their kids are. And she didn't think much of it at first, but after a while it seemed kind of ridiculous that they would do that so much. So she decided to follow up on this finally, after years of the mothers basically bragging about how smart their kids are. And she decided to do a study on this, and what she found was so ridiculous that basically turned into multiple studies later on, all showing the same thing, that the progesterone babies, as they were dubbed, were way smarter than even babies from people that didn't suffer toxemia of pregnancy during their pregnancy, basically women that were fine. And these progesterone babies should have been lower on the intelligence because the mothers were sick during pregnancy, but it turned out they were smarter than normal babies, and way smarter than babies from mothers with toxemia of pregnancy that weren't treated with the progesterone. So let's review the first study, called Intelligence and Prenatal Progesterone, a reappraisal. So basically it talks at the start about how the mother of one of the progesterone babies noticed how intelligent they are, and it prompted a question to the researcher Katharina Dalton: could the progesterone be responsible for the intelligence in these children? So at first they just decided to survey the teachers of the children, and they did find that more progesterone children were deemed as smart by their teachers compared to controls in the same class. But nothing spectacular at first. But after that pilot study, things got a lot more interesting, because they decided to continue, thankfully, their research, and the results got more and more distinctive as the studies went on. The next study, they found out through hospital records which mothers received the progesterone during pregnancy and which didn't, and then they tracked basically their kids at the age 9 to 10. So they used the control group and the progesterone group at the same ages, and they contacted their schools and head teachers and asked to assess the child's ability in verbal reasoning, arithmetic, English, craftwork, and physical education. And these results that I'll get into later more in depth again prove that progesterone kids were better in every aspect, but aside from craftwork and physical education. So they were better in verbal reasoning, they were better in English, they were better at arithmetic and math, but they weren't better at craftwork, which is again more of a spatial physical skill, and physical education, which is again more of a spatial and physical skill. So this gives you clues early on how progesterone increases intelligence. It may not be an increase in physical intelligence, and maybe not as much in spatial intelligence, but more into more into academic subjects. And again, of course, the striking thing is that the progesterone baby should have been lower in intelligence, not higher, which again seems very promising to somebody that doesn't have any disorders during pregnancy but still uses progesterone to enhance its baby's intelligence. Not that I'm giving any medical advice here, but just saying that it seems very promising. Another key point in these studies is that the effects are dose dependent. So those who received the higher the progesterone they received, the smarter the babies were in all of the studies as far as I remember, but we'll get through them anyways. So stick with me, guys. The next study they did was in babies, and they measured the child's ability to walk, how fast they learned to stand and walk. Again, the progesterone children did better than the control group, and the results were again dose dependent. The children whose mothers received over 8 grams of progesterone while they were pregnant fared better than those on the lower dose. So again, this gives us clues about the optimal dosage of progesterone during the pregnancy if you want smarter kids. But this is not like a key study. This doesn't say much to me. Like more progesterone children were standing and walking at 1 year, but the really key studies I think were the ones that measure the child's abilities later on when they are older in terms of their IQ tests or academic achievements, which is exactly what the next study did. And they looked at the progesterone children and normal children at the ages 80 to 20 years old. So they measured their academic achievements, and what they found was that the progesterone children stayed at school longer, attained more O and A levels, and 32% of the progesterone children went on to university in comparison to 6% of the normal controls, which is also was the average at the time. 6% basically went to the university of the population at the time the study was conducted. So the chance of a progesterone child going to the college was 6 times higher than the national average at the time, which is clearly statistically significant. I mean, clearly shows that the progesterone children had way more academic achievement compared to just normal children. The results were again dose dependent, with the best results in those children who received the treatment before the 16th week of pregnancy and whose treatment continued longer than 8 weeks. And again, another interesting thing is that a significant amount of the progesterone children chose to study sciences or what is dubbed as male-oriented subjects. There were a couple more studies pointed out in this reappraisal, but they didn't strike me as particularly interesting, so I won't go into them. But the interesting thing, though, is that the authors of this pointed out that there is a disease called adrenogenital syndrome, which is basically a enzymatic defect in cortisol synthesis, where there is high prenatal progesterone naturally in these people with this defect. And they actually found that the mean IQ is significantly above that of the normal population in the people with this defect. So this is another pretty direct clue that prenatal, high prenatal progesterone leads to higher IQs in people. So the author's conclusion is, from this is, it would seem that progesterone administered in early pregnancy is beneficial not only for the relief of pregnancy symptoms and the prophylaxis of preeclamptic toxemia, but also to enhance intelligence. They say it will not produce a race of geniuses, but merely ensures full brain development, which I'm not sure I agree with completely, because in all the studies the result was dose dependent. So every time the higher the progesterone the mothers received during pregnancy, the smarter the kids were, basically. So I don't think it's fully explored what the ideal dose is, or even if they gave enough of a dose during the pregnancy. Maybe if you gave an even higher dose than they measured, the kids will continue to be smarter and smarter. So it's not exactly clear to me that it will actually not produce a race of geniuses. It could very well do that, actually. But anyways, guys, thanks for watching. This was part 1 of the series on intelligence and prenatal progesterone administration. I have 3 more studies to go through by Katharina Dalton, where we get into the results more, and that have way more of a sample size. This was just an intro video. I don't want to make this too long, as it's already, I think, more than 10 minutes long. So we'll see you in part 2, I guess. And if you want a genius kid, supplement progesterone during pregnancy, but always consult with the doctor before you do that. Don't forget to give me feedback on this. Like, subscribe, comment if you liked it, if you didn't like it. You'll see that the results get even crazier with the next studies, and this was just the tip of the iceberg when it comes to progesterone and intelligence research. So see you guys in the next videos.